Hello, everyone. Just waiting for everyone to join. Perfect. Feel free to put in the chat, where you're joining from and something you're excited to learn about today or something that brought you here today. We know your time's valuable, especially at a lunch hour. So great. All right. Well, I will go ahead and just kick things off. If Christina or Liz, if you see the waiting room and individuals to add, that would be great. Okay, well, happy April Fool's Day, everyone, and the first day of Oral Cancer Awareness Month. So that's great to have those two on the same day. Welcome to Advancing Veteran Oral Health for California. I'm Tooka Zokaie. I'm the Senior Health Policy Analyst with the California Dental Association. And it's a real honor to be here today to have this presentation in conjunction with the American Institute of Dental Public Health and two of our shining leaders at California Dental Association. Our goal for today is to go over a little bit of the landscape within California for advancing veteran oral health, some of the persistent challenges and how we can overcome them. And there will be time for us to have kind of a Q&A and discussion to brainstorm about, what more is needed to change and what questions you have that you would ask us to investigate. I would like to begin by introducing Dr. Richard Nagy and Dr. Karin Irani, our two co-presenters today. So Dr. Richard Nagy is a board-certified periodontist, past president of California Dental Association in 2020. So think of what was going on in 2020. So he handled a lot. The California Society of Periodontists and the Western Society of Periodontology. And after 22 years in private practice, he's the director of the Greater Los Angeles VA Periodontal Residency Program. And you can see his white coat, so, you can fact check. And he was the chair of the CDA Medicare Task Force and a member of the ADA Elder Care Work Group. So very honored, very thankful to have you here today. And Dr. Karin Irani graduated from University of Southern California in 2003. She's the recipient of a multitude of dental awards, including the Icons of Dentistry Award by Ultradent for her contributions to the Veterans Smile Day programs. She's a strong leader within the ADA and CDA. Dr. Irani grew up in a military family, so she understands the sacrifices of our military men, women, and their families. She has a profound desire to help make a difference within the dental community through her extensive volunteer work with a sharp focus on expanding the number of dental societies and private practices willing to open their doors to provide care for our United States veterans. And I'm Tooka Zokaie, and I'll just be doing a quick overview of a recent piece of legislation in California that we think is important for our teams to know about. So there's a recent piece of legislation that was passed just last year, and it's temporary license for a military spouse or domestic partner residing in California. So this impacts our dental workforce, and it's the permits for dentists, dental assistants, and dental hygienists can be granted to spouses or domestic partners of active duty military service members residing in California. So this helps those individuals that are maybe coming from another state and they're now working within California on a military base in California or military service in California. And if their spouse is in one of these dental professions, they can be granted swiftly a temporary license. And they'll be permitted to work in California, same capacity as their out-of-state license for up to 12 months or until the standard license is issued. So we highlight this to say that CDA was in support of this passing, and we are really thankful to see that, for military families that a barrier is removed. So these are the kinds of legislations that we are thinking about and working on when it comes to our dental members and their families. Just another quick overview of the VA dental insurance program. So enrolled veterans are eligible beneficiaries and the opportunity to purchase dental insurance at a reduced cost, but California dental insurance program offers discounted private dental insurance, and usually for most veterans, comprehensive dental benefits are not part of their overall plan. So this is a misconception that we wanted to address. That really only current law limits eligibility for dental care to veterans with a service-connected disability rated at 100%. So that isn't the majority of veterans, and California is the state with the most veterans in the US. So those are a lot of veterans that are navigating the private dental insurance market, but providers may not be completely aware of that. So just in case, we wanted to clarify that challenge. So California Congresswoman Julia Brownley, she introduced a bill in 2023 Congress. This is national, and it was to authorize the VA to provide dental care to all veterans enrolled in the VA healthcare system. It was referred to the House Committee on Veterans Affairs and the Subcommittee on Health, but it did not move forward to law. But it looks like this is a bill that is once again being introduced. So this is something to be aware of. And we're proud of our own Congresswoman for introducing this. So California dentists, they led the way in addressing the oral health needs of diverse populations, including veterans. CDA continues to advocate for access to care. We want to share the best practices and address these unmet dental needs. So I will be passing it off to Dr. Karin Irani to share how we do that.
Thank you so much, Tooka, and thank you everybody for having me here. As Tooka mentioned earlier, this is an issue that is very dear to my heart. Growing up in a military family, I understand the intensive, lifestyle that they have and the sacrifices that their family have done. So a few years ago, we started with one of my classmates. We're going to go over it together, the Veterans Smile Day. And a couple of years ago, realizing the workforce issues in California, I started serving Our Smiles, another nonprofit, to help our veterans reintegrate into the society. Next. All right, so I think Dr. Nagy is going to go over the numbers much better than I do, but I was not aware of this issue that most veterans do not qualify for dental benefits after they leave the service. As we mentioned earlier, my father was in the military, and I was aware that he gets very good health care, but he had a wonderful dentist, being me, of course, and I didn't realize that he's not getting any dental benefits because I would take care of everything for him. So a few years ago, one of my classmates approached me, and he's the one who brought it to my attention that among the 23 million US veterans, only about 15% of them qualify for dental benefits, which was a shock to me. And as Tooka mentioned earlier, and I think Dr. Nagy is going to go over it, they have to be 100% disabled in the course of their service or injured during a war to be able to receive dental benefits. And some of the veterans have explained that to me, that you can have a disability of 60%, like a knee injury, and 30% or 50% on an elbow injury. They don't add up. So it has to be 100% one injury. So unfortunately, I realized that many of the veterans do not receive any dental benefits. Go ahead. So this is Dr. Pham, my classmate who approached me a few years ago, and he's the one who explained all this to me. Go ahead. And so together, realizing what is happening, in 2013, we started our program, Veterans Smile Day. And this program has been very successful for the last few years. The first year that we started, of course, it was kind of like, strong arming some of the doctors to participate. Well, we started with about 30 doctors, different, nationwide, reaching out actually to our old classmates and some of the friends that we had. And we started in different states like Massachusetts, California, New Jersey, and Texas, and individual doctors in Florida, Arizona, basically some of our friends that we reached out to, and we explained the issue to them, and they were more than happy to participate. So our program started in 2013. Go ahead. And these are some of the pictures of the first few years. You see this Dr. Daneshwar, she's actually in Los Angeles area. So whenever I could, I would go and lend a hand to different offices. We received supplies from Henry Schein, Patterson, and later on from Ultradent. So because we had a diverse group of people, and it was very hard for Henry Schein, for example, to send individual packages to their offices, they would send us the big packages, and I would start like going through them, making smaller boxes, and either like delivering, literally like delivering it to the offices or mailing them to different offices. Go ahead. And this has been going on in 2018. Before COVID, we actually had a lot of the schools participating, some of the dental societies, like the Texas Dental Association, the New York Dental Association. They actually grouped their doctors together, and we were able to have more than 800. Of course, it's always very hard to get the data from the doctors and different organizations. That has been one of the biggest challenges for us. And another big challenge I would like to share with you is reaching the veterans. So the two challenges is receiving data back from the doctors, and the main one was actually reaching to the veterans and let them know that these services are available. But even with that, we were able to see more than 3,000 veterans, and some of the goals of the program that I'm going to go over it with you is to actually find a dental home for the veterans and actually their families. Go ahead. So these are again some of the pictures of the doctors who have been participating. Keep going. I'm going to go over some of the services that we provide. So we wanted to make it as easy as possible. One of the things that is specific about this program is that we are not doing like a large venue like CDA Cares or something like that the doctors go. They can provide the care in their own offices. A lot of times that makes it much easier because they're used to their own chairs. They have everything they need there, equipment, material, and all that. And what we have been asking the doctors is to provide as much care as they can or as little, however they're comfortable. So they basically usually do the x-ray exams, regular cleaning, sometimes deep cleaning for the patients, fillings, extractions, root canal therapy, crowns, and sometimes even ongoing. So a lot of the doctors, if the patient needs ongoing treatment, like they need an appliance or they do a root canal on that day and they need a crown afterward, they either do it for free or sometimes they just charge a lab fee for the patients, or they give like a huge discount, like 40-50% discount on their regular fees. So they want to make it possible for veterans to get as much care as possible. Go ahead. And again, like I said, we try to make it as easy as possible for the doctors to participate. So when we ask them to see the veterans, sometimes they just see 2-3 veterans on that day. Some of them, they block the whole day and they see like 20-30. There's an office actually in Palmdale area that they see about 150 veterans in one day. They bring doctors from the area, they all participate. It's a very large office and they're able to see a lot of patients, and sometimes they refer those patients to other specialists that are participating in our program. So the main goals of our program is, first of all, of course, to provide free dental care for the veterans, but most importantly is to bring awareness to the veterans' needs. So everybody is aware that this is an issue that needs to be discussed and eventually taken care of. And of course, the doctors, we want to encourage them to participate and provide free dental care. To me, it's a win-win situation. The doctors get so much goodwill in their communities for what they're doing. Some of them, like you saw in the pictures earlier, they have like banners putting outside their office that they have Veterans Smile Day, and they bring other volunteers from the communities, other businesses in the community, and they all participate in this. They make it a whole day of veterans special. And some of them, so it brings them some community standard. And also it's great for the veterans because they receive the care. So we want to make sure that not only they receive the care for that day, but also we want to encourage the doctors to find a dental home for veterans. And a lot of times, I hear the doctors saying, a veteran brought their family with them, they brought their children, they're like, can you also see them? And I have never seen a doctor refusing that. So not only it extends to the veterans, it extends to their families too. Go ahead. So again, some of the pictures that you're seeing, this is actually Dr. Pham's office in New Jersey. Not only his staff are participating, he brings other people from the community who help him. Go ahead. And so these are some of the supplies that I said, like we receive the packages all together, and then we make smaller packages. Either we mail them to the doctors, or sometimes, we deliver them if they are. So we receive the East Coast, West Coast packages, and we manage it. We want to make it possible for our sponsors to donate. So ADA has been a great sponsor. Henry Schein, Procter and Gamble. Henry Schein donates amazing. Like they literally, they ask us, what do you need? We send it to you. Anything from composite to patient bib to anesthesia, we ask them, they give it to us. Procter and Gamble has been great. They give us patient care. And like I said, Ultradent has been very active with us lately too. Go ahead. So again, what is the difference between this program and other programs? Again, they can see as many or as little patients as they can. Sometimes, like 2 or 3 between regular patients. And sometimes, like I said, up to like 150, whatever. And then they do the care in their offices. So it's much more comfortable for them. They can get the staff to come in. So they all participate. It's a team building actually exercise for them. And they get non-dental volunteers. I can just talk about my own. Sometimes my sister comes to the office. She has no idea, about dental offices. And the first time she was like, what do you want me to do? I don't know what to do. I'm like, just come to the front, because I knew we're going to be so busy. I needed all my assistants in the back. And I just told her, just give the forms to the veterans so they can fill it out. Just make sure everything in the front is nice and it flows to the back. So she loved it. At the end of the day, she came to me. I mean, we had a full day from 8, I think, to 6 o'clock nonstop. We were going, and at 6 o'clock, she was exhausted. She came to me and she was like, now I see why you do this. She was literally in tears, and she was like, I have, because my dad passed away, and she was like, I keep seeing that in every single one of them, because the discipline that they have, the mannerism of the veterans. If you have worked with any veteran, you see that, and you appreciate it. So she was like, okay, when is the next time? When are we doing it again? So that's the kind of appreciation you get from the volunteers, and they love getting involved. Go ahead. So again, some of the doctors, when it's in the office, it's safer, and it's kind of like they can make it a fun day. You see, they're joking around with the patients, and these are all patients. I know these doctors. These are all patients that have become a patient of the office, and they keep going back because they feel comfortable with the doctors now. Go ahead. So what can we do? How can we help? And what is possible to do? Like I mentioned earlier, it is very hard to actually reach the veterans because they don't have a good network that we can actually just spread the word to them. I work with many organizations that work with our veterans, like the American Legion and Elk Lodge, and different organizations that help, or Project Gratitude. So those are some of the ways that we try to spread the word. Of course, CDA and ADA have been great supporters just by putting the information in their news journals and everything, spreading the word. Not only we want to spread the word to the doctors, and always we want to recruit more doctors, but also we want to reach out to veterans. And of course, the more sponsors we have, the better it is, and the more care we can provide to some of the patients. Like some of the dental associations, they have their foundations. Actually, they cover some of the cost of the care, like lab work or something. So all we have to do is send the lab work, the statement to them, and they reimburse the doctors. And also, as usual, getting the community involved. Every time I talk about the veterans to anybody, they are like, how can we get involved? What can we do? So that is a great building, the relationship with the community. Next, please. Okay, so these are some of the organizations that have been taking care of the veterans, and of course, ours is one of the many. I don't want you to think that we're the only ones, but there are many, and the good thing is that because of all that we have done, and all the, the issues that we have been, the awareness that we're bringing, ADA is actually forming an advisory group, and I have been very fortunate to be asked to be on it, to create Give Veterans a Smile events, like give kids a smile, if you have heard about it, something similar but with veterans. So that would bring all these groups under one umbrella, and they would help with their efforts and sponsor them and actually support them. So ADA is moving forward with that, and we're going to have the announcement, I think, in New Orleans. So I invite everybody, if you can come to New Orleans, we're going to have a huge event to announce the new veterans efforts from ADA, and I'm sure CDA will participate with that. Go ahead. So again, our volunteers in the news. Go ahead. So like I said, it's great for the patients, and it's great for the doctors. And my partner, Dr. Pham, says, serving those who have served. My tagline, and I share that with Tooka, is we can all give one day to those who have volunteered to give their lives. So I hope that we can help them in many ways that we can. Thank you again.
Hello, hi, Richard Nagy here. And Dr. Irani, thank you so much for that great presentation. I mean, I've known Dr. Irani for at least 15 years, and I know she's been involved with the Veteran Smiles and is so passionate about it. So it was great to have you bring forward what you're doing to help those veterans who don't have a dental benefit at the VA. So my role here is to tell you and inform you all, what do we do for veterans regarding dental at the VA? I am currently in the VA right now. I am the program director of the Greater Los Angeles VA Periodontal Residency Program, where I was a resident myself in the 1980s. Ouch. And then I was also here running the program back in the 90s and early 2000s. And then I left and went to private practice in Santa Barbara for 22 years, and I've been back here since 2020. So my role is to actually tell you all what the VA does, because it's really confusing. And part of what you were informed by the presentations is actually currently now incorrect. And I'll explain what I mean. Next slide, please. Just me and a very, very young, soon-to-be veteran. Next slide. So this is the VA where I'm currently at. It's the West Los Angeles VA. I'm in that building on the ground floor, which means there's no windows. But I'm here now to give a presentation. We are a tertiary care medical facility. We have a dental service on the ground floor. We employ about 60 people, 60, in the dental clinic. We have 3 residency programs: general practice residency, prosthodontic residency, and periodontics residency, as well as full-time general dentist, prosthodontist, dental hygienist, and all the support staff is 25 assistants to support all of us. So we do a lot for the VA patient. Next slide. But this is where it gets crazy. And this is what I really want to just let you know, that the true skinny of what happens. So dental benefits are authorized by the VA according to law. And according to Title 38, blah, 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 of federal regulations, the VA is authorized to provide extensive dental care, while in other cases, treatment may be limited by law. And I'm going to describe what this whole dental eligibility criteria means. Next slide. You said 23 million veterans. The numbers always change. We have 16 million veterans. And of those, Dr. Irani and Liz from AIDPH, thank you, AIDPH, for hosting this. I got to just say, I'm so impressed, because I think this is a really needed resource informational webinar to help people to get involved. But they said 15% are eligible for dental care. That is correct, but what does that mean? Not all 15% get comprehensive dental benefits with maintenance. Not so many do, and I'm going to talk about which ones do and which ones don't, because it's all based on eligibility. Next slide. So again, it's by eligibility, and they're under different categories: class 1, 2, 2A, 2B, 2C, 3, 4, 5, and 6. And there's differing rules per each. Next slide. And so for VA outpatient dental care, the ones that are listed, minus the ones with the asterisk, are typically ones who get lifetime care with maintenance, and they get recurrent dental care. Just because you go through one phase of dental treatment doesn't mean you're done, especially people prone to periodontal disease, people who have had endo infections and then need crowns so teeth don't break. Things happen over time. Class one are typically those who have been in service way before. There's very few of these people still alive. The class two recent military discharge, according to law, the people have to fill out a DD 214 form. And then once it's been approved, they have, I think, 30 to 60 days to come in for an exam, and they have up to 2 years to complete dental treatments. And if they don't have the dental treatments completed during that time, then they're not eligible. Their eligibility cuts. And then we have people with dental trauma, homeless while they're undergoing certain types of treatment will get dental care. And as a side note, the West LA campus has been all over the news because we actually have converted buildings and building new ones to house the homeless veteran population here on our campus. So then they'll have access to both medical and those who qualify dental. Prisoner of war greater than 90 days, class 2C have lifetime dental benefits. Class fours are where you're talking about the service connection of 100%. But as you can see, there's a lot of different categories, and that's the only one that has 100%. And then class five is vocational rehab. They undergo dental benefits while they're in the rehab program, but once they graduate from the rehab program, then they lose their benefits. Next slide. Okay, and then there's the categories 3 and 6. And as I mentioned, we're a tertiary care hospital. So the way it works is all veterans have some level of medical benefits, but only a small portion have the dental benefits as defined by law in these different categories. Categories 3 and the 6s are where we get consultations from a medical provider, and these are people who don't have dental benefits that identify a medical condition that's being aggravated by or the management of which is complicated by the dental program. That's a 3. And then the dental service chief or designee must review the consult and determine dental eligibility and scope of care, which is usually limited. The next slide. So these category 3s, again, dental condition is professionally determined to be aggravating a service-connected medical condition, not a dental, and they get focused care to address that specific problem. And the extent of care only is determined by a dental professional evaluation. So we get these what's called medical clearance consultations, radiation therapy clearance consultations, where we need to sign off that the patient is at low risk for an infection to their medical status of what's going on. Primarily the class 6s, such as those undergoing a joint replacement, those undergoing bisphosphonate therapy for osteoporosis are undergoing a treatment for cancer, and they're undergoing bisphosphonate care. People undergoing radiation therapy to the head and neck must have a dental consultation in order to identify the infection to make sure it doesn't aggravate the medical condition. It's really complicated. However, then we're allowed to address a one-time effort to remove infection to allow that veteran then to undergo their medical treatment. But they are not eligible for dental care. Again, so the next slide, please. I'm sorry, I just blocked myself out. And so just wanted to let you know that, so once you get past this category issue, then whether you're eligible for comprehensive care or focused care, then you get to be seen. And then we are highly trained dentists. We use the latest procedures, pain control techniques. Most of the VA dentists are specialists and have achieved their specialty training at a VA. Like I did my VA perio here in 1988. And I love treating the veteran patient. And that's why I'm so excited about this webinar and future ways we can help this group. It's an amazing group of people. Just to listen to their stories of what they went through to defend our country, the traumas they went through, how they had to readjust their life when they came back, how hard it has been for a lot of them to get a job and socialize based on the trauma. Many have PTSD, where when I was at the Florida VA, I'll never forget, I was in a room The flickering lights set off one of the veterans. He jumped out of the chair and pretended he had a machine gun and was shooting everyone in the room with the pretend machine gun because of the PTSD. You know, I can't imagine what these people went through, but we are so happy for those who are eligible under that criteria that we can actually, you know, take care of their dental needs for them. We have state-of-the-art dental clinics. There's over 200 in the country. We have the highest standards for infection control. My private practice in Santa Barbara was considered to be the top-notch infection control office. Compared to here, I needed a lot of improvements because we follow hospital protocol, not dental office protocol. That's one of the big differences. Next slide, please. We do everything for the patient that you would do in a dental office, depending on their category and their classification. That's what limits what can be done. So we do regular cleanings, radiographs, restorative work to treat caries. I'm a periodontist. We do, you know, scaling and root planing, periodontal surgery, gingival grafting, aesthetic surgery, sinus lifts, ridge expansions. We do a lot of dental implants for those who are eligible and then restore them. And some really highly complex cases that it rivals anything at a dental school. I mean, it's really top-notch. Procedures are done by top-notch dentists. Next slide, please. And so this is, if you're interested, you can go to https:// as noted to find a dental clinic near you. This is where anybody who lives throughout the United States, Puerto Rico, and Philippines can find a dental clinic. Like I said, we are the largest in the entire country. Next slide. And this is, to me, sort of takes most of what I said and sums it up. Those are all the different classes here on the left, class 1 through the class 6. And then this gives you your scope, defines it, its scope of care, but the key is the recall. So we do recall only on 3 or 4 of these classes. And then again, eligibility for some of these classes, you don't have to be 100% service connected. You need to be, it keeps changing, by the way, the law keeps loosening. Recently, you need to be 50 to 100% service connected for something and be either unemployable or disabled. One of those will give you dental care. So that's probably something you all didn't know. That allows that person access to the dental service. And besides all the clinics that I showed, over the 200 dental clinics, a law came into place called the Mission Act of 2018. What the Mission Act does is opens up veterans' choice depending on how long it takes to get an appointment in a VA dental clinic or the distance to the VA dental clinic by time, that you can actually see a care in the community provider in a private practice in your community, as long as they have signed up with the VA as almost like a healthcare insurance, but the patient doesn't pay, to be seen in private practice. And so that's something that some veterans have, especially where I'm at in Los Angeles, in West Los Angeles. It could take some time for someone to drive 6 miles to get to see us. And so those veterans who it's more than, I believe, 60 days, 45 miles, or minutes of time, they get to go to care in the community, but they have to fill out a consultation. So we do a lot for these veterans. But as I stated, this is such a small number of veterans compared to all the veterans who've served in our military. And the thing is, those categories 3s and 6s, I keep talking about them, these focus care, no recall, wherever it says no recall, where do they go? They need to find a home in their community where they can have their ongoing oral health care needs met. And that's why this webinar, to me, is so vitally important, because this is the way to give these veterans access to care. Oral care, as we know by studies, relates to their overall medical wellness. And again, thank you, AIDPH, for what you're doing to bring this to our attention and give us the resources of what people can do to help out. Thank you so much.
Thank you so much, Dr. Nagy and Dr. Irani. I think that, you've summed up so much of the different areas that work is going on, and ongoing clarity and access to care. And I echo what Dr. Nagy said with thanking AIDPH. I believe Liz put some resources in the chat, or I don't think they're there yet. I don't know if you
I
want to
can
talk a
pop
little bit
them in
about
now.
them.
Sure. Yes, I absolutely can. Thank you, Tooka. I'm Liz Flannery. I'm the Director of Education with AIDPH, or the American Institute of Dental Public Health. And thank you so much, everyone, for being here. This is our second session in a two-part series where we're talking about advancing equitable oral health for veterans in California and beyond, the countrywide. So we feel that this is an incredibly important topic and important work. So thank you again, everyone, for being here. And for those who didn't join us in the first session, I just wanted to share those resources here to kind of give us a foundation and a base of the details that we're talking about here today. So I'm going to pop a few resources in the chat here. If you're not familiar with AIDPH, we empower our community to advance oral health through science, education, and advocacy with a vision of working towards a justice-oriented oral health system. We have 4 communities of focus, one of which is the veteran population, which is why we're here today talking about this. And when you're looking at our veteran oral health portfolio and the work we do with that population, it's really those 3 pieces that's in our mission: science, education, and advocacy. So we invest in community engaged research in the veteran population, and then that research informs the education and advocacy projects that we do. So over the past year plus, our teams have been working on comprehensive analysis of veteran oral health in each state and developing out state profiles along with a report card for each state that really gives an overview of what veteran oral health looks like in each state. And we're doing a virtual road tour of seminars to share that data with the states and also hear from the stakeholders like yourselves in those states about success stories, data they may see missing. We want to really keep those conversations going and understand what's going on the ground for folks and how we can support and how we can help, and also get our data tools in the hands of folks who are doing different programming and advocacy projects to advance veteran oral health. So as Tooka mentioned, we did a first seminar where we really gave an overview of veteran oral health in the country and then dove into that state profile in California. So I'll post that. I have a recording of that first webinar. So if you were unable to join us, please take that link, look at the first webinar. Our executive director, Annalise Cothran, really gave a comprehensive analysis of that data. And then I will also share a link to the state's profile specifically for California. So I'll pop those in. I know Tooka is going to lead us through some Q&A and some discussion. If anything comes up about those resources, please chime in with that. And also, please share openly and freely. Part of these sessions are to hear from the community and stakeholders about what's happening, what you're seeing happening, and the questions you have about veteran oral health. So I'll pop those in now.
Thank you, Liz. And I already see a few comments in the chat that I'm going to dive us into, but if you have any questions for our speakers or AIDPH or CDA, please put them in the chat. So the first one comes from, I think, Dr. Chiandri from Southern Alameda County Dental Society, and they've been hosting Give Veterans a Smile Day for 2 years now, and have offered about over $70,000 in free dental care. So I don't know if there's anything more you want to share, either like a success story or just like one of the things you think really stood out about the event, or a lesson learned. But if you're comfortable sharing that, please feel free to unmute.
Yeah, hi, thank you. It's Melinda Chandri, not a doctor.
Chandri.
I'm the executive, that's okay. I'm the executive director of the Southern Alameda County Dental Society. And we originally were our dental society was a dental provider at the East Bay stand downs for almost 20 years. But unfortunately, COVID, was the end of the stand downs. And so now we just host them in conjunction. We hold a single day event, 23 and in 24 in conjunction with our Give. We do Special Kids a Smile Day instead of kids, where we treat disabled children and adults. So our past 2 events for Give Veterans a Smile, we treated close to 50 and 60 veterans consecutively each year, providing $35,000 and $36,000 approximately on each of those single days. As I think Dr. Irani mentioned, one of the hardest things is reaching the veterans, and we really have gone out into other local nonprofit organizations to reach those veterans. Unfortunately, the VA is unhelpful with us. They have refused to advertise. They have refused to promote our events to veterans in their care. And so we've had to find different avenues. And so, organizations like Swords to Plowshares, Wounded Warriors Projects, things like that, where we've been able to get in touch with veterans. But the thing that we found is that the veterans are so profoundly grateful for a simple cleaning, if that's all we could do. But we did comprehensive care. We've provided Laurel one-day dentures to veterans at these events where, we may have removed the last remaining tooth in the morning, and by 4 p.m, they've got a full set of dentures. So those things are important to us. The other thing that we have found really helpful, and to Dr. Nagy's point about the PTSD, we always have on site therapy animals, and we bring therapy pets to our events so that, when we do a quick health assessment and we maybe check a blood pressure of a veteran's and their blood pressure is too high for us to do treatment, we pull out a dog out of our pocket and we sit that dog on their lap, and all of a sudden the blood pressure drops again and we can get the treatment done. So, there's lots of little tricks and tools that we found that have been really successful in our events in being sure that all of the veterans that come to us get some sort of treatment.
Wow, I'm like taking notes about some of the things you shared. I have a follow-up question as well. So something that, we're also working on addressing is that long-term care, and especially with those local events, like, within Alameda County, have there been any, like lessons learned or pathways to help it be, beyond a one-day care event and try to establish long-term care? Has that been, within capacity?
We not as successful as I'd like it to be. Certainly, I don't think it'll ever get to be as successful as I want it to be, in terms of providing that long-term care and finding a dental home for those veterans. But what we have found is that our volunteers who come for these events, whether it's the veterans or the disabled individuals who maybe are not used to treating a homeless individual who, doesn't look like people have this vision of what someone who's homeless is supposed to look like, and it's nothing like what it actually is. And these are, incredible individuals who've put their life on the line for our country, and they just happen to be living in their car now. And so a lot of times we found that our volunteers are willing to open the doors in their offices to take on 1 or 2 of the veterans that they saw during our events, for that continued care, because it all of a sudden the preconceived notion that they might have had about a veteran or someone with PTSD or someone with a disability looks or acts like in a dental chair is sort of demystified, and now they're willing to take them on.
Wow. So the exposure through you could say safety of the event and like the interest in the event can help destigmatize some of those preconceived notions for long-term
Exactly.
potential cares. I think that's very interesting. Dr. Irani, I see your hands up.
I just want to add to that, like you mentioned, the first few years that I was asking the doctors to see the veterans, unfortunately, because of the misconception that they had that was associated with the, term veterans, there was some resistance sometimes that, oh, I don't know if I want these people to come to my practice. And understandably, the doctors realized that, there are many, many, many veterans that actually the number of the homeless are going down, and we are helping the veterans to find better jobs and reintegrate into the community. So more and more doctors realize that these are just regular people like you and I, and sometimes just because they cannot afford the dental care, they need our help. It is not so much, they're working. So our program, we don't ask any financial questions. As long as you're a veteran, you qualify for the care. Some of them, they have jobs and they work, and I don't really care if they can afford it or not, because that is my way of paying them back and help, thanking them for their service. So that is a misconception, as you mentioned, and more. And I think that is one thing that helps when they go to a practice, that again, many doctors reported that the veterans call them back because they have a toothache or something, and they say, oh, I came to your practice for the Veterans Smile Day. Can I come back and can you help me with this too? So they end up making a relationship, building a relationship with those practices, just because they're more comfortable. They have already met the doctor.
Thank you. Dr. Nagy, I also see your hand.
Yeah, I just wanted just to comment as I'm listening. If I was in the audience, my first question I would have is, there's a lot of resources, we gave a lot of information, but what's the very first thing you need to do to start seeing these patients? What's the linchpin that allows you then to move forward? I'm sure that's on a lot of people's minds, and I personally don't know the answer.
Yes. So, and I think a big piece of it was said earlier with the destigmatizing. Some individuals are turned away from dental offices just because they are a veteran, and it's unclear if, well, then you need to go, you need to go to the VA, not knowing that a majority, even with the different classes you went through, are going to be in private dental offices or different kinds of dental offices. So, I think that's the first piece. And then I know that AIDPH has some resources on this, and CDA does as well, but understanding also trauma-informed care, because that is something that is very likely to come up as well. I don't know if there are any veterans on this call that are veterans themselves, but in different spaces where there are, that is something that comes up a lot. And you brought it up too, Dr. Nagy, how PTSD and different traumas are going to be something that the dental office can trigger, with the different sounds, the different vulnerabilities that come with being in a dental chair. So those are some of the things that we recommend, is trying to get more comfortable trauma-informed care, and then destigmatizing veterans as patients. But I'm sure Dr. Irani has more, because again, I'm not a dentist. So.
Sorry. So one of the things, I think public education is so important, educating our doctors and also the public on the issues that you just mentioned. It is very, very important. And myself, when I see veterans, I sit with them, and the first question I ask is, how are you doing? Literally, like, how are you doing? And you would be surprised how many of them, they look at me in shock, because I don't think that many people actually care to ask them that question. And so when we start the conversation, the next question is like, is there anything that I should look out for? Any triggers that you want to share with me that I should be considered when I'm treating you, and my staff should be aware of it? And they do tell you, they would tell you, I hate this, or the light, or, the sounds, something like that. So we try to work with them however we can. I don't have training on PTSD and how I should treat a patient with PTSD. But what I do have is a compassion about person who has gone through what I know they go through. So it's mostly, for me, is personal knowledge, but I think maybe even some educational seminars for the doctors would be very helpful, because we do treat more and more patients with PTSD, not just veterans, but overall in general public. So that would be very helpful. And also, when you come from a place of compassion, they're more willing to share with you their experiences and how best you can treat them. So it is the communication part.
Thank you. Thank you. And I see, also diving into that is being able to offer care and helping with Medi-Cal enrollment, and also some challenges when they're not eligible for Medi-Cal. So I think just to focus our last few minutes on that. So the first question, I think, and this one, Dr. Nagy, I hope you can answer. If a veteran is not eligible for comprehensive care, does the VA assist veterans in applying for Medi-Cal?
So I do want to emphasize, I work in the dental clinic, and that's the only section of the VA that I work in. And there's so many different levels and bureaucracy and people who determine eligibility. So I cannot answer that, nor can I answer the follow-up one on the assistance with the Medi-Cal billing. However, I do want to say is that the VA does an extensive education and assistance for the veterans. They have the patient advocacy office here at the VA. When any veteran has any issue, they will go to the advocacy office, and the advocacy office will reach out to whatever departments they can to help assist the patient. I mean, I'm curious into the Medi-Cal questions myself. I actually going to research it after this. I can't answer it right now because my guess is a lot of the veterans, not all, or even, maybe even not a lot, but there is a high percentage who are means tested based qualifying for Medi-Cal. And that I think it would be of service, and the VA may already do it in terms of advising and counseling the veteran on how to get to these services. The billing part, oh man, that's a $100 million question. I really can't answer that one, except to say that those who participate in the care in the community with outside dental practices, they have to go through the VA and sign up as a provider. And I'm assuming that for the facility that treats the Medi-Cal patients, and thank you for doing that, they would probably have to do similar and sign up. And then if they sign up and there's a contract, quote unquote, then yes, they will get paid by the VA for those patients.
Yeah, so to reiterate the key piece for Thomas's question, a non-VA clinic can bill the VA, but the VA has to pre-authorize the care. So that's usually the biggest barrier, is that pre-authorization. And that does not need to be done in a VA setting. So I will have some homework to do to see how that pre-authorization piece works, if it's case by case basis or clinic by clinic or provider by provider basis. Or both.
But if we're talking specifically about dental, because that's medical. Dental's different. It's really, really different. And I know that we have to have that provider or facility providers be contracted with the VA. You have to be an authorized provider. You can't just bill it to the VA. The VA will not pay you. Because we've had many instances that I've actually been involved with specific cases where that question has come up. But no, you actually have to be a provider and then pre-authorize treatment that then for dental goes through the dental clinic. And I will then be asked periodontal specific questions on that treatment to see if that's warranted. And then once that provider who is sanctioned already through the VA has a pre-approved authorization, then that provider can then submit the bill. That I do know.
Right, so both the provider needs to be authorized ahead of time, they pre-authorized, and then the care also that they plan.
The pre-authorized care,
yeah.
they'll send a
So it's
treatment
both.
plan, and then we will review it and authorize it. Correct.
Yes.
There's a whole billing, there's a whole department for these consults, and it's rather extensive.
Right. So as we're looking at different potential policy initiatives or advocacy on the barriers, it seems like this seems to be one of the significant barriers to care. So that is something that, I know AIDPH may be investigating, and same with CDA, as well as the Medi-Cal enrollment. That's another piece that would be outside of the dental office, but there are VA supports for enrolling in different kinds of care. And California is a state that has comprehensive adult dental benefits in Medi-Cal. Okay, well, I know we have about 5 minutes left. I don't know if there are any other pressing questions. Would routine preventive services like individual pro fees need to be pre-authorized? I would believe so.
Yes.
Because both the individual provider would need to be pre-authorized as well, and then
actually yes and no.
yeah.
So I'm not the expert on this, but from dealing with it. So if you are a provider authorized through the VA, so you did the paperwork and you are listed as a VA provider to have dental care for service-connected veterans, then pre-authorization under $1,000 doesn't need to happen to get paid. But it doesn't mean that you will get paid. But if anything over 1,000, you mandated have to have a pre-authorization. And again, under 1,000, you don't.
Yes, and so for
It's
that,
confusing. It's
it
really
is
confusing.
And for that under 1,000, and this goes for any billing, is that's why the documentation needs to be so clear and so important, because that usually is one of the biggest reasons claims are denied, is because they haven't been properly documented. So I'm interested to continue that conversation and see how we can maybe make it a little more clear, or do a guide for how to enroll as a VA, how to get authorized as a VA provider if you're not in the VA. I see Liz nodding. I don't know, Liz, is that something that AIDPH is working on or maybe interested in looking
We
at?
aren't. That's not something
Okay.
we're working on currently, but I think that this conversation really highlights some of the complexities that are involved, and like you said, that create those barriers, Tooka. And so I just wanted to kind of name that. I appreciate the questions, and name that it can get really in the weeds, and one of the barriers that we talk about is that it can be really confusing for both providers and patients. And when we talk about that number of veterans who have the benefit, who don't have the benefit, there's a fair amount of folks who have the benefit and don't access, and there's a lot of reasons that go into that. Transportation can be one of them, many barriers. One of the barriers is sometimes confusion about what the benefit means and what they can and can't access. So I just wanted to name that and kind of give an additional prompt for those other resources we shared that really dive into the data, but also say a thank you to everyone for being on here and bringing up those thoughtful questions, and having a commitment to learn about this and pursue this information and have these community conversations that kind of unveil some of these pieces that we can maybe work together on a more systems level with those advocacy pieces that you're talking about, Tooka, like a how-to. Maybe that's something that the state can work on and bring some clarity if we work together as a community. So a lot of pieces to keep talking about, but kind of wanted to just name that and thank everyone. And really, I really hope we keep this conversation going and look at those other resources, and folks reach out with additional questions that come up, both to CDA and AIDPH.
Yes, thank you. So to kind of wrap up today, I want to thank, of course, American Institute of Dental Public Health for inviting CDA as a partner for these 2 webinars. And I do encourage to engage with the resources that they shared. Thank you, Dr. Irani and Dr. Nagy, for both being champions for veteran oral health and just equitable oral health access in general, as well as an umbrella of the work you do. So it means a lot that you took time on your lunch to be here today, everyone that participated and asked questions. And I took some notes about kind of what's the first thing to do if you want to offer care, some Medi-Cal enrollment questions, and of course some pre-authorization guides if you want to be eligible to offer VA services in a non-VA clinic. I see some emails in the chat. I will also put mine as a follow-up if you have any questions or requests for CDA. And these are recorded. Both of the webinars are recorded. So this one will be shared later through AIDPH, and CDA will share it again as well. And with that, I give you back 0 time. So thank you. At least we didn't go over, and have a great April, everyone.
Thank you, everybody. Bye-bye.
Thank you so much for this. Thank you.
Thank
Thank
you.
you.